Yes. Auntie Agatha, Auntie Nkechi, come and sit down. Come and sit down. I want to ask you a question. Why are you always shouting at your children when they take more of oily food? When they take pear, you shout at them, and they should stop taking pear now. They should stop taking enough oil. Why? Because of malaria. So who told you that oil causes malaria? Who told you that plenty oil in the body causes malaria? Did I? Of course I did not. Okay, let me put you through. I know you do not know. There's only one thing that causes malaria, and which is what? The bite of an anopheles mosquito. That is the only thing that causes malaria. Now how? When a mosquito bites you, it drops a plasmodium parasite that contains a sporozoite, which when diffuses into your red blood cell causes malaria. You understand now? That is what causes malaria, not oily things. Now this plasmodium parasite is divided into 4: falciparum, malaria, vivax, and ovale. Falciparum, Plasmodium falciparum, is the most dangerous of all because it does not have dormant stages, unlike Plasmodium vivax and ovale that have dormant stages. But falciparum and malaria, they don't have dormant stages. They act immediately. Once it is being dropped in the blood, they act immediately. But vivax and ovale, they stay through dormant stages in the liver. Remember, only the sporozoites in the red blood cell causes malaria, but the parasites, those ones in the liver, cannot, except it diffuses and entered into the red blood cells. That is when it can act and cause malaria. And these vivax and ovale, they can stay up to 2 weeks to 2 years in dormant stage in the liver. But the falciparum and malaria and plasmodium malaria, they act immediately. These vivax and ovale, they are the ones that after treating malaria, you are finished treating malaria, taking malaria drugs, and you're okay. After some time, you start having malaria again. The ones in the dormant stage in the liver, when they get diffused again into the red blood cell, it will cause a malaria known as malaria relapse, because it was not the actual one that happened, that which you treated is not the one that you're suffering from now. You're suffering from the one that plasmodium parasite that was stored in the liver, that was in their dormant stage in the liver. You understand? That is the one that causes this second malaria known as malaria relapse. Now, it's not just that one. You know, sometimes there are drugs that we take, or maybe when you have malaria, you just run down to the nearby chemist or pharmacy there. You just self-prescription, self-medication. You just give yourself drug. Just give yourself malaria medicine because maybe you've known 1 or 2 malaria medicine. You just take it, and then after quite some time, you just feel better. And then sometime again, you start having malaria again. There are some malaria parasites, those ones that were still in the red blood cell, that drug you took could not kill entirely, and so it will multiply again. Yes, it will remultiply and causes malaria recrudescence. Malaria recrudescence, yes. And that is the reason why you need to go to hospital. That is the reason why you need proper medical attention whenever you are sick. Yes. Remember, malaria relapse are the malaria you get from the Plasmodium vivax and ovale that were in the dormant stages in the liver. Malaria recrudescence are those ones that's your drug that you took that time could not entirely kill. So it will multiply again and cause malaria recrudescence. Then you'll be like, you just treated malaria. Who said you treated malaria? You just took medicine. Medicine that you're not even sure of. Stop self-medication. When you are sick, you go to the hospital. When you are sick, you get the attention of a medical practitioner, a professional. That health is wealth. Health is wealth. So, Auntie Nkechi, I hope I've been able to convince you that oily things does not cause malaria. Only mosquito. Only female anopheles mosquito. So stop shouting at that child. Stop beating that child and stop taking oily things. You understand? Stop it. It's only mosquito. Only mosquito. So you need to protect yourself against mosquito, because as long as there's mosquito bites, there will be malaria. And so when this occurs, you know what to do. You seek an attention of a medical practitioner, a professional at that. Stop self-medication. Thank you. So, guys, do not forget to share, like, and subscribe. Stay tuned. You always have more from me.